The Boston City Council is responding to the health emergency by changing procedures, but also by exerting leadership in a different way. Normally, there's a focus on constituent services and local regulation, but councilors have filed a number of measures to address urgent concerns related to the outbreak. To tell us about those efforts is the City Council President and District Councilor from Roxbury, Kim Janey. Thank you very much for being with us, Councilor.
It's great to be here, Chris. Thank you for doing this. It's really important that we're able to communicate with residents throughout the city around what is happening and how they can protect themselves. So thank you for the opportunity.
Council, I want to start with the feel of the district. As in many places, you can walk out down some main street and see it's almost completely deserted. But in Roxbury, greater Roxbury at least, I think of other things going on like the meals program that's run by Violence in Boston. What's your feel of the community right now?
Well, the first thing I would lift up and elevate is just the resiliency of the residents of Boston, certainly my district, how residents, how community leaders have all stepped up. Certainly want to shout out, those on the front lines, our nurses, doctors, janitors, the grocery store workers, everyone who is delivering food, making sure that our young people have their Chromebooks. Everyone is really stepping up. Certainly want to shout out my colleagues on the Boston City Council for all of the work that they are doing, as well as responding to constituent concerns, as well as the mayor and his team. Everyone has really come together. I think what I see in my district certainly is a slowing down in terms of being outdoors. And it's really important that we get the message out how critically important at this stage for those who can to stay home. And I know that is not easy for folks. Weather's getting nice. And not everyone has that choice. Some of these frontline workers are out there working, making sure that we have what we need as a city in terms of responding to the healthcare crisis. What I worry about and what I also want to lift up, Chris, is the economic devastation. And so while we are certainly concerned about residents contracting coronavirus and ending up with COVID-19 and possibly passing away from this is a very serious illness. We also have to concern ourselves with the economic devastation that will be left in its wake. And so this is having a huge impact. Many of the businesses in my district that were already in transition, trying to attract new business and keep their doors open, are now facing really difficult times before them. And so we all need to make sure that we are responding in such a way that we don't perpetuate some of the inequity that we already see. It's important to note that we are starting with a $250,000 wealth gap. So that's our starting point. And so as we recover from this, and let me note this, the city of Boston did open up applications just yesterday for a small business relief fund, as well as relief for tenants, rental relief fund for tenants. Those applications opened up yesterday. You can certainly go to my city council president page on Facebook or the city of Boston's website to find more information about that, but just wanted to elevate that.
One of the things I've noticed, because you brought up the relief for businesses, and there's also relief for renters, I've seen that there are these steps that are implemented at other levels because they have more power to do so. But I also see that the city council pushed for these at an early stage, even if just through resolutions. How important do you think that was?
Oh, very important. And again, I am so grateful to serve and lead in the city of Boston now as city council president, working with my colleagues on the city council who have all stepped up. All kinds of resolutions have come forward. We've adopted just at the last meeting a resolution calling for a moratorium on rents and mortgages. We see a similar bill at the State House. So not just my colleagues on the council, so I want to also highlight the work that is happening at the State House with state reps and state senators leading efforts there. It's really important that we all come together to face this crisis together.
Since this began, we've seen the map put out by the Boston Public Health Commission about the neighborhoods in Boston that seem to be bearing more of the brunt of the illnesses right now from COVID-19. What do you make of that?
Yeah. So the first thing I will say is it is really important that we understand the neighborhood data, that we understand the data by race and by income. One of the things that we can be proud of here in Massachusetts is how aggressively we are testing people in our Commonwealth. That is certainly true within the city of Boston. Um, Last Friday, I was looking at the numbers comparing Massachusetts to the overall country. And at that time, Massachusetts represented a third of all tests that had been conducted. And so one thing that we know is the more you test, certainly the more positive cases you will find. And so we see we are now number 6 in the country in terms of confirmed cases, Massachusetts is, and that is because we are testing. And so when we see cases, confirmed cases in our neighborhoods, that means that those tests were available to folks in those neighborhoods, and potentially those tests were available because maybe those are frontline workers. Also important to note, though, again, when we have a system that has built-in inequality and inequity, we have to watch that data, and we have to be intentional in our response to make sure that we are not perpetuating that data. So right now, I think we want to continue to gather the data. All of the data is not complete. Some facilities collect data by race and income, and some don't, so when they're doing the test. And so we do need more complete data before we can draw conclusions. But I would suggest that those are places where tests are available, but it is also true that we have to look at the data in terms of race, income, zip code, et cetera, to be sure that we are not perpetuating inequities in our city. When it comes to testing, when it comes to confirmed cases, when it comes to deaths, when it comes to recovery efforts, we have to be intentional about lifting up issues around equity.
Speaking of equity, what about equity in education for students who are learning outside of school right now? How do you think that's going in Boston?
Well, I would just commend certainly our educators who've had to transition very quickly into a new normal, a new classroom setting. I have to commend our young people for doing the same, and certainly have to shout out all of the parents who find themselves at home now trying to work from home, if that is the case for them, as well as care for and help their children in this new normal. The first thing is making sure that all of our young people have their Chromebooks. And there is a plan in place, I understand from our new superintendent, to ensure that that is happening. We also have to recognize that, again, the starting point is a place where there are already opportunity and achievement gaps, particularly for Black students, Latino students, for children whose first language is not English, and for students who have disabilities. So we have to recognize that. We also have to recognize that within the new classroom setting, which is every household throughout our city, not every child is participating fully. And so we have to now track and monitor to make sure that our young people are able to log on. And if they're not, what are the barriers? And then even for those who can log on, we also have to acknowledge that in certain households, there may be space to really have that classroom setting. In other households, there might be a lot going on. And so we have to support our parents and helping find ways that they can support their young people, their children's learning at home, as well as supporting our educators in this effort. What I will say is that this is not the time for state takeover. I know you were probably aware that I testified at the Bessie, Bessie board meeting, along with two colleagues of mine, Councilor Edwards and Councilor Sabi George, against any notion of a state takeover at this time. Certainly we have challenges in Boston. No one is hiding from that or running away from that. We have unique challenges that I think we are uniquely positioned to solve. I lend my support as council president, as a District 7 counselor, as someone who has spent a lot of my career working on education issues, committed to doing all that I can to support our young people, to support our educators and families as they transition. I think it's important that we begin to have conversations around what summer learning opportunities look like for our young people. I think it's safe to say, despite our best efforts, remote learning is not the same as a classroom setting within the Boston Public School building. And so it's important that we try to be forward-thinking and proactive when it comes to ensuring that our young people have what they need, and so that we are not, at the end of this, seeing wider gaps. We need to be aggressively focused on eliminating the opportunity and achievement gaps that already exist, and then understanding that this COVID-19 could have an impact in terms of widening some of those gaps. And so we've got to be intentional in our efforts. I think it's important as we talk to families through our schools, or however we're talking to families, that we make sure that we are doing so in multiple languages. So that has come up a lot on the council. Councilor Flynn raises that issue, Councilor Mejia. These are very important issues, and we need to make sure that everyone has access to the information.